Hi everyone, my name is George. I'm going to be performing a head and neck video assessment for the Advanced Self-Assessment class at Regis College. This is Christina. She's going to be my volunteer for this assessment. Christina, do you give consent for this neck and video assessment?
Yes.
Thank you. So first, I'm going to start with assessing her head and facial area. So first, I'm going to palpate her skull, noting for any deformities, masses, or any lumps. Her occipital area is normal, no tenderness, and no pain when I touch, right?
Right.
Hair distribution is normal as well, and her skull and head is symmetrical. So now I'm going to move to her facial area, again noting for symmetry. Her facial area looks symmetrical. We're also looking for lesions, any masses, tenderness, erythema, or edema. Okay, perfect. So now I'm going to move to her eyes, assessing her eyes. First, I'm going to note if there is any crusting around the eyelids or her eyebrows. There's no crusting, so everything looks good. No redness or swelling around the eyes, no discharge. And now I'm going to inspect her internal structures of her eyes. So I'm going to use the ophthalmoscope. So I'm just going to have you open your eyes. I'm going to assess for her pupil, the size of the pupil, her lens. We're noting for the white color around the eye. We want to see a white color. We're noting for any jaundice like yellowish color. And hers is, I'm going to start with a light, okay? Hers is white, looks good. The lacrimal apparatus is free of discharge, no redness. Same for the other eye. I'm assessing for the same structures. Okay, can you open yours for me? Okay, perfect. So now I'm going to assess for more internal structures like the fovea, the macula, the optic disc, the retina. And I'm going to go ahead and do that. Very good. The red nerve looks good too. So now I'm going to use the Snellen chart, and I'm going to have Christina read 4 letters of the alphabet from a small distance. If you can read starting from A.
A, B, D, E.
Okay, perfect. Everything looks good for the eyes. I'm going to continue the assessment with the ears. So first I'm going to see the outer parts of the ear. We see for symmetry in relation to the head. They look normally placed. Pinna and tragus are free of redness or any swelling. No discharge on the outer parts, and then the following assessment will consist of assessing the tympanic brain and the ear canal for cerumen, any deformities, or any other signs of any infection or anything like that. So I'm going to pull the outer part of the auricle. Can you turn that way for me, please? Okay. So now I'm assessing the tympanic brain, which is translucent. I don't see any bulging, no redness or swelling, no cerumen, or any other signs of infection. I'm going to do the same thing for the other ear. Again, the same thing, there's no signs of any increased cerumen production. The tympanic brain of her left ear looks good, translucent as well, and no signs of redness or any edema. I'm going to continue my ear assessment with using the tuning fork. I'm going to perform two special techniques that assess her hearing ability, and that's how we detect any hearing loss. So I'm going to use a tuning fork. First, I'm going to perform the Weber test. So basically, I'm going to, you're going to hear a buzzing sound. I'm going to place the tuning fork under your, on the lower part of your, or the ear, and then above your ear. And I want you to tell me if there are any differences in the sound, okay?
Much fainter. And fainter.
Perfect. So now I'm going to do the same thing for the other ear.
Louder and fainter.
Okay. And the next test is the Rhine test, which is basically performing the same action by placing the tuning fork on the midline of the skull. Are you able to hear that?
Very faintly, yes. Mm-hmm.
So after assessing the ears and the eyes, I'm going to assess the nose. So again, we're looking for symmetry. I'm going to palpate for any nasal obstruction, no obstructions, no tenderness. I note that there's no, you can lean back from me, no discharge, no epistaxis, no bleedings, no ulcers, but I'm going to set some light there. Looking for any deviated septum, and I think Christina, her septum is a little bit deviated, but no other deformities, no redness or swelling, no bleeding, no perforations of her septum. So now I'm going to test her olfactory nerve. So I brought an herb. So I want you to block one of your two nostrils, and I want you to tell me if you can smell that.
Mm-hmm.
Okay, if you can block the other one now. Perfect. Okay, so after assessing the nose, we have assessed the ears, eyes, and nose. We're moving to the mouth. So now I'm going to use the light again. I want to, if you can open your mouth for me. So now, perfect, thank you for sticking out your tongue. We're assessing the tongue, no white patches, no other redness or swelling here. Teeth are intact, no ulcers. Gums look good, pink and moist. No open like bleeding spots or anything like that. Can you do this for me to see your teeth? Perfect. Her lips are pink as well. There's no cyanosis, no blue lips, which could indicate some decreased oxygenation. So now I just want you to open your mouth. You don't have to stick your tongue. I just want to see if your soft palate, which is like the top of your mouth, is okay. Perfect. Very good. Intact. And I just want to see your tonsil area, if you can do that for me. Very good. The anterior and posterior pillars are at a normal position. Yes, perfect. So after inspecting the mouth, I'm going to assess her lymph nodes and her neck area. Okay, so the lymph nodes, I'm going to palpate your lymph nodes I'm going to start from your ears, and I'm going to work my way down to the neck, and you're basically close to your shoulders. So first, I'm going to palpate her posterior, so her pre-auricular lymph nodes. We're assessing for tenderness or any for her mobility and consistency. No tenderness here. I'm gonna move my way back to the posterior auricular lymph nodes. I'm noting the same thing, no tenderness or hard nodule association. Then I'm going to work my way back to the occipital area where we have lymph nodes as well. No tenderness as well. And then I'm going to move down to I'll work my way to her chin in an easier term to explain. So I'm going to her tonsillar, which is the angle right here. No tenderness. Submandibular right here, which is in the middle towards the chin area. No tenderness as well. And the submental, which is the chin basically, and no issues here either. So I have noticed no tenderness, no swelling, no erythema, no hard lymph nodes in the first assessment. And now I'm going to go to the cervical lymph nodes. So first are the anterior cervical lymph nodes here. no tenderness. Working my way down to the sternocleistomastoid muscle, assessing for the same characteristics, no tenderness, no redness. Do you have any pain when I palpate?
No.
No. Then closer to the trapezius, right here, I do this. I'm not noting any abnormal signs, ominous signs for any malignancies, because these areas here are more associated with malignancies if there are any objective signs. Here. Perfect. So after assessing the lymph nodes, I'm going to, the last part of the assessment is assessing the trachea for any for any deviation, and her thyroid for any nodules or any redness or swelling there. So I'm just going to assess your trachea here. No deviation. And now for your thyroid gland. No pain here, right?
No.
Okay. So I didn't notice any abnormal signs of her thyroid gland. Her trachea is not deviated. So from a whole assessment, the only notable finding was her deviated septum that we assessed from the nose assessment. Thank you.